Dr. Matthew Nodelman, Prisma Health, Family Medicine and Preventative Care. Well, I actually grew up in Columbia, South Carolina, Northeast Columbia. Had a great time living here. Went to Presbyterian College for undergrad and then Medical University of South Carolina in Charleston for medical school. Just moved back from Cincinnati, Ohio. My wife and I moved up there for our residency training. We met in medical school. I think the key for me doing family medicine was getting that personal relationship and that sort of partnership with patients, and I felt like that was best suited for me and what I could provide for them. I think that my style of practice is I try to make it as natural as possible and as conversational with the patients as possible. Really just try to have that one-on-one time with them. I ask them about how they're doing, ask them about their families and friends and, really their life outside of their medical conditions. And I think in doing so, that's how we can really make that connection and help them the best way. Making a decision to practice medicine at Prisma Health is very exciting for me, having grown up in Columbia and having spent some time outside of the city. I'm very excited to come back home and practice in a city where I grew up and provide for my community. I think the advice that I would give to patients is really to, advocate for themselves, both when we're in the office together, but also when they're dealing with, maybe other specialists or even family members, kind of explaining and asking questions and really just sort of advocating for themselves. That way we can, figure out not exactly why they're coming in, but what do they truly need.